Common cardiac labs. Alanine Aminotransferase is also called SGPT. It is a liver enzyme and may increase when using cholesterol-lowering medications. Abnormal apolipoprotein levels may significantly increase the risk for coronary artery disease and heart attack. Lifestyle measures such as diet and exercise and lipid-lowering medications may decrease this risk. Brain natriuretic peptide. This is a protein that the heart and the blood vessels produce. The BNP helps the body eliminate fluids, relaxes blood vessels, and funnels sodium into the urine. When the heart is damaged, the body secretes high levels of BNP into the bloodstream to try to ease the strain on the heart. BNP levels may also rise if they have new or increasing chest pain, unstable angina, or after an MI. The BNP level can help in diagnosis and evaluation of heart failure and other heart conditions. Normal levels vary according to age and gender. One of the most important uses of BNP is to try to sort out whether shortness of breath is due to heart failure. For people who have heart failure, establishing a baseline BNP can be helpful, and future tests can be used to help gauge how well the treatment works. CKMB and CK isoenzymes. CKMB begins to increase 6 to 10 hours after an acute MI. It peaks in 24 hours and remains elevated for up to 72 hours. CK kinase, or creatinine phosphokinase, is a muscle enzyme found in the heart and the muscles. Increased CKMB is seen with heart muscle damage. Increased CKMM is seen with skeletal muscle injury. Strenuous exercise, weightlifting, surgical procedures, high doses of aspirin, and other medications can elevate this creatinine kinase. It may also increase when using cholesterol-lowering medications. C-reactive protein. An elevated level of CRP indicates an increased amount of systemic inflammation, which may heighten the risk for coronary artery disease. High-density lipoprotein, cholesterol. This is sometimes called the good cholesterol because it helps carry away the low-density lipoprotein cholesterol, keeping arteries open and the blood flowing more freely. It is common that HDL cholesterol is higher in women than in men. Homocysteine. A high homocysteine level may increase the risk for coronary artery disease and MI. Increasing the intake of folate, vitamin B6, vitamin B12, and by eating more fruits and vegetables may reduce homocysteine levels. Lactate dehydrogenase. Total LDH will begin to rise 2 to 5 days after an MI, and the elevation can last 10 days. LDH is an enzyme released in the blood with cell injury. It is used as a late marker to detect an MI. It is also elevated with liver and kidney disease, pernicious and megaloblastic anemias, malignancy, progressive muscular dystrophy, and pulmonary emboli. Low-density lipoprotein cholesterol. This is sometimes called the bad cholesterol. Too much of it in the blood causes the accumulation of fatty deposits, the plaques in the arteries, the atherosclerosis, which reduces blood flow. These plaques sometimes rupture and lead to major heart and vascular problems. Myoglobin is an early and sensitive diagnosis of MI in the emergency department. This small heme protein becomes abnormal within 1 to 2 hours of necrosis, peaks in 4 to 8 hours, and drops to normal in 12 hours. Myoglobin is a protein found in certain types of muscle. Elevated myoglobin may indicate muscle injury or inflammation. Serum glutamic oxaloacetic transaminase, SGOT, is an enzyme that is normally present in liver and heart cells. SGOT is released into the blood when the liver or heart muscle is damaged. The blood SGOT levels are elevated with liver damage, like hepatitis, MI, and some medication. Total cholesterol is the sum of the blood's cholesterol content. A high level can put the person at risk for heart disease. Ideally, the total cholesterol should be lower than 200 milligrams per deciliter. Triglycerides. This is another type of fat in the blood. High triglyceride levels usually mean they regularly eat more calories than they burn. High levels increase the risk of heart disease. The American Heart Association recommends that a triglyceride level of 100 milligrams per deciliter or lower is considered optimal. Troponin Complex. This can peak 10 to 24 hours and begins to fall off after 1 to 2 weeks. Troponins are muscle proteins that are part of the cardiac and skeletal muscle. Smooth muscle cells do not contain troponins.